Welcome to the Amherst Holdings 2018 Open Enrollment presentation. Before we get started, I need to inform you this presentation is a general overview only and is not intended as legal advice. In the case of any inconsistencies between the information presented here and the plan document will prevail. We will review the medical and ancillary benefit options, employee contributions. We will cover how and where to enroll and where to go if you have any questions. Open enrollment begins November 17th and will end Wednesday, November 29th. Elections you make now will remain in effect January 1st through December 31st, 2018. After open enrollment, you will only be permitted to make a change if you experience a qualifying life event such as a birth of a child, marriage, or divorce, for example. This year, we will remain with United Healthcare for our medical plans, and there are no other carrier changes. However, we are pleased to announce an enhancement to the health savings account. More on that in a few moments. First, we will review the medical plan details. None of the plans or benefits have changed from last year. Here we have the buy-up plan, a $1,000 deductible PPO plan with a $25 PCP copay. There is a $25 specialist copay if the specialist is part of the designated network. If the specialist is not part of the designated network but still in network, it is a $50 copay. There is a $75 urgent care copay, and as with all plans, preventive care is covered at 100%. Should you need to visit the emergency room, you will pay a $250 copay and then be subject to the deductible and coinsurance. Prescription drugs are subject to a 3-tier formulary with $15 for Tier 1, $40 copay for Tier 2, and a $75 copay for Tier 3 drugs. You also have the option of using a mail order pharmacy, and with that you get up to 90-day supply for 2.5 times the retail copays described above. The second option is our base plan with a $2,500 deductible and a $30 PCP copay. There is a $30 copay for designated network specialists or a $60 copay for a regular network specialist. Additionally, preventive care services are covered at 100% as they were under the previous plan. Urgent care will run you $75, and if you need to use the emergency room, you will pay a $250 copay and then be subject to the deductible and coinsurance. Again, on this plan, prescription drugs are covered at a 3-tier formulary. Tier 1 prescriptions will run you $15, Tier 2 prescriptions will be $40, and Tier 3 prescriptions will run you $70. Again, you can take advantage of a mail order prescription and get up to a 90-day supply for 2.5 times the retail copays. Deductible health plan option, which offers the lowest premiums. Once again, as with all plans, preventive care is covered at 100%. Everything else will be subject to the deductible and coinsurance under this plan, including prescription drugs. Once you have met the deductible in full, the prescription copays will apply. This is the only plan that allows you to contribute money to a health savings account to build a healthcare nest egg. Also, Amherst will continue to contribute to your health savings account if you enroll in this plan, making it a very attractive option financially. But the best news is Amherst has increased their employer contributions into your health care savings account if you enroll in this plan. Savings account? In simple terms, it is like a 401k for healthcare. You set aside pre-tax money to pay for eligible expenses, but it is your bank account. There are no use it or lose it provisions, and Amherst will also deposit money each month into this account. With the funds in this account, you can use them to cover qualified medical, dental, or vision expenses such as deductibles, coinsurance, and copays. If you participate in the high deductible health plan and open your health savings account, you can set aside money on a pre-tax basis. It can be invested and earnings accumulate tax-free. You will not pay taxes on this money if you use it for eligible healthcare expenses. Or you can let it grow for retirement and then use it for things such as Medicare supplement premiums, COBRA premiums, or even long-term care coverage. For a full list of qualified healthcare expenses, please see IRS Publication 213D. This kind of tax savings is a great benefit to having a high deductible health plan. Enrolled in a qualified high deductible health plan, you cannot be covered by another plan that is not a qualified high deductible health plan, and you cannot be covered by a spouse's healthcare flexible spending account. Additionally, you are not able to be enrolled in Medicare, Medicaid, or TRICARE. If you meet all of these qualifications, you are eligible to open and contribute to your health savings account. For 2018, the IRS has set the maximum contribution limit to $34.50 for employee-only coverage. For those covering dependents, you will be able to contribute a maximum of $6,900 per year. Additionally, if you are over the age of 55, you can contribute an additional $1,000 per year per their annual catch-up provision. Please note, the IRS maximum takes into account both employee and employer contributions. And enhanced for 2018, Amherst will now provide an increased company funding to your health savings account. The company funding will be distributed on a quarterly basis. For 2018, if you cover just yourself, Amherst will contribute up to $600. If you cover an employee plus spouse, you will get $840. Employee plus children will be $960, and if you have full family coverage, Amherst will contribute up to $1,200 into your HSA account. Again, please remember the IRS maximum includes both employee and employer contributions. Please be mindful of this when making your HSA contribution election. And now let's review the differences between the FSA and the HSA. The HSA is owned by you, the employee, and funds can be used for medical, dental, or vision expenses, as well as Medicare premiums, COBRA premiums, or long-term care. Only the employee is required to maintain supporting documentation for your claims and must be enrolled in the high deductible health plan. Funds roll over from year to year on your HSA account. Now for the FSA. This account is owned by the employer, and the employer is responsible for validating or substantiating the claim submitted. You do not have to be enrolled in a medical plan to elect the flexible spending account. Flexible spending account funds can be used for medical, dental, vision, and dependent care expenses. Please keep in mind this is a use it or lose it account, therefore any monies left over at the end of the plan year will be forfeited. Here are some examples of how the high deductible health plan matches up to the PPO copay plans. This first example reflects employee-only coverage and assumes this is a very low benefit utilizer. This employee has 3 office visits, 1 specialist visit, as well as 1 preventive care visit. Additionally, we assumed 12 monthly fills of 1 generic prescription. As you can see from the example above, the high deductible health plan is much less expensive than either the base or the buy-up PPO plans. This calculation takes into account the total annual premium you will be paying per payroll period, as well as your deductible, coinsurance, and copays. Again, as you can see, your total annual cost on the high deductible health plan for this scenario is much cheaper than either one of the copay plan options. The second example assumes employee plus child coverage and assumes this is a medium benefit user. As you can see, we've plugged in multiple primary care visits for both employee and child, as well as a couple specialist visits, some urgent care, an emergency room, and then some prescription usage. Based on the information we input in this example, you can see the total annual cost would be cheapest to go with the base copay plan. Again, this takes into consideration your total annual premium as well as the deductible, coinsurance, and copays you can expect to pay under each plan. Assumes employee plus family coverage, and it assumes that this family is a very high utilizer of the benefit plan. We have got multiple office visits plugged in for each family member, as well as urgent care visits for everyone and emergency room visits. We have also estimated a inpatient hospital stay, as well as numerous prescriptions for the family. Based on the services we entered in the previous page of the calculator, the total overall out-of-pocket cost will be cheapest on the high deductible health plan. Again, this takes into account what you can expect to pay for the year of premiums, as well as deductible, coinsurance, and out-of-pocket maximums. Again, this particular scenario, you would be best served if you were to join the high deductible health plan. Employees enrolled in the PPO plans can enroll in the flexible spending accounts for medical expenses. The maximum contribution for 2018 is $26.50. If you choose to enroll in dependent care, you can contribute on a pre-tax basis up to $5,000 for child care expenses or daycare expenses, provided they allow both parents to work on a full-time basis. These plans do have a use it or lose it provision. However, Amherst does allow you an additional 2.5 months after the plan year ends to submit receipts for your expenses which were incurred in 2018. Regardless of the plan you elect, you can still use myuhc.com to navigate your healthcare experience. Go online or download the app to find a doctor, look up claims and access prior EOBs, print a temporary ID card, use estimator tools, as well as look up health and wellness tools and information. If you or your family members have a prescription, we also recommend you download this OneRx mobile app. With this mobile app, you can look up the cost of your medications and help determine which location you can get your prescription for the least out-of-pocket expense to you. You can also upload your medical ID card and have your benefits validated to help you navigate the prescription system and ensure you are getting the cheapest prescription available. Please reference your contribution handouts for payroll deduction amounts. Please also note the HSA plan will remain as the free medical plan for employee-only coverage. Our dental remains with United Healthcare and is shown here. This plan includes a $50 individual deductible or a $150 family deductible. Each covered member will receive an annual maximum of $1,500. Preventive services are covered at 100%. Basic services are covered at 80% after your deductible, and basic services will include things such as fillings and oral surgeries and simple extractions. Major services are covered at 50% after your deductible, and major services will include endo and perio services, as well as bridges, dentures, crowns, inlays, onlays, and things of that nature. The dental plan also includes an orthodontia benefit for children up to age 19, and that benefit is payable at 50% with a lifetime maximum of $1,500. Here is a look at the vision plan through United Healthcare. The vision plan includes a $10 copay for your exam, and then single, bifocal, and trifocal lenses are covered at 100%. Frames have a $130 allowance, and then you get a 20% discount off of the balance over $130. Necessary contacts are covered at 100%, and elective contacts are also covered under this plan. If you select a contact from the selection list, you can get up to 4 boxes. If you select a non-selection contact, there is a $105 allowance available to you. Please note that the exams are covered once every 12 months, lenses are covered every 12 months, and frames are covered every 12 months. However, contact lenses are in lieu of frames and lenses. You cannot get both in one 12-month period. Out-of-network coverage is available, however, the reimbursement is much lower on the out-of-network side, so it's best to stay in-network if at all possible. Please refer to your contribution handout for your payroll deduction amounts. The dental and vision plans remain free for employee-only coverage. Amherst provides 1 times your salary to a maximum of $50,000 for basic life and AD&D coverage. Should you wish to purchase more coverage, you may do so at this time. Please note the guarantee issue amount shown applies at your initial eligibility window only. If you do not enroll when you are first eligible, or if you elect over the guarantee issue amount, you will be required to submit a health statement before you can be approved for this coverage. Should you not be able to work due to an illness or injury, the company offers short-term disability benefits. These benefits include a 15-day elimination period. Therefore, benefits will be payable on day 16. The disability benefit pays 60% of your weekly salary up to a maximum of $2,308 per week. You can collect the short-term disability benefits for up to 11 weeks. Amherst cares about you and pays 100% of the cost for the long-term disability through Sun Life. We hope you never have to use this benefit, but it is important to protect your income should you miss work due to an illness or an injury. Additionally, Sun Life provides emergency travel assistance and identity theft protection. Amherst employees also have an employee assistance program available for all matters of work-life balance, legal issues, family matters, daycare, or elder care. Please remember to reach out to ADP's EAP. Telephonic counseling is available 24 hours a day. To wrap things up, the ADP portal will be available to make your 2018 elections through Wednesday, November 29th. Please note, this is a passive enrollment. What that means is you do not have to re-enroll in the benefits if you do not wish to make any changes. The only exception to this is if you are enrolling in the FSA or HSA. Should you have any questions, please reach out to your CLS support team via email or phone. They are available and ready to assist. Thank you for listening to the open enrollment presentation.